Welcome to the topic of health systems and NCDs. This presentation is guided by the following proposition that NCDs are a challenge to health systems, and I'm coming back to that, what I mean by that, and I will end up proposing also some solutions and showing some examples. Let's have a look at the outline of this topic. First, I'd like to review a little bit the building blocks of health systems, then the primary health care approach, and then talk also a little bit about health systems research as giving you a bit of a background. Then I'll give a summary about integration of health services, because that is paramount to what is currently being talked about, improvement of NCD management. Then we look into the assessment of health systems preparedness for chronic disease management, and I'll introduce you a recent very interesting tool on how that could be done. And finally, we come to solutions, where I highlight some ideas to increase funding for primary health care in the literature and out there an initiative, and then also some examples of the integration of chronic infectious care with NCD management, and give you some further tools and examples. Now let's start with my proposition. Let's set the scene. The global disease burden has changed everywhere towards chronic conditions. However, our health systems haven't. Then, for most major chronic conditions, highly effective interventions exist, but quite often patients do not receive them. And our current, or many of the health systems we have, are designed for episodic and acute care. However, chronic conditions are lengthy and require continuity of care. This is a summary you can find in the WHO publication about innovative care for chronic conditions, published in 2001. I give you one example about this NCD and healthcare system challenge from the US. There it was published in 2003, so 10 years ago. A huge number, 99 million Americans, lived with a chronic illness. And meeting the needs of this population turns out to be a major challenge. And I'd like to give you this example from the US, because to illustrate that this healthcare challenge, how to deal with chronic diseases, is not only something developing countries struggle with, but here you have an example from a health system or a society, a country which spends most likely the biggest amount of health and still is struggling. I'm citing this paper because it was published by Ed Wagner, whom you will meet in the next slide again, because he's the key and the lead author behind the chronic care model, the CCM, which is quite often referred to or used when talking about a different way on how to manage chronic diseases. You'll find this model also in some of the literature I'm recommending for this topic. I'm not going into this much more, as it's dealt with the literature, but you see there certainly the health system at the center. But I like to highlight one thing without exploring this further in this topic, and that is the informed, activated patient as a key part of this dualism, or this team, this productive interactions between the prepared, proactive practice team and here the patient. Because quite often I think this is being neglected a little bit, how to get to an informed, activated patient. So there I'm alluding to the huge topic of self-management. And self-management will have, I think, an increasing meaning and importance in chronic disease care. Self-management can be defined as the individual's ability to manage the symptoms, treatment, physical and social consequences and lifestyle changes inherent in living with a chronic condition. Here's a reference to it, and this is unfortunately the end of me talking about self-management, because we are coming back to health systems and NCDs. But I wanted to highlight there's a lot more into a comprehensive approach of chronic disease management. Now, let's go back to the background. What is a health system? A health system is that which includes all the activities whose primary purpose is to promote, restore, or maintain health. In other words, a health system is not just a health care system. So it also includes a health system that looks at the financing of the health care system, the governance and provisioning measures from, of course, drug supplies, but also from the healthcare workforce, their training, etc., etc. Whereas the objectives of the healthcare system can be listed as the following: to contain costs, to increase efficiency, maintain equity, and improve quality. And every time I'm reading out this list, I have to smile about, because obviously this slide I took from somewhere else, because it was a very concise summary about the health system, and I'm personally surprised why the creators of this slide listed as the first objective to contain costs. I thought the first objective would be to provide healthcare in an increasing efficient manner, maintaining equity at the highest quality possible, and thereby containing costs. That would be sort of my order. Anyway, this is in a nutshell what a health system is about, as opposed to the more focused area, the health care system. Another way to describe the health system are the famous 6 building blocks of a health system you see there on the left, which was formulated and published by WHO in 2007. So there it is about service delivery, the health workforce, health information, then medical products, technologies, vaccines, drugs, then the financing about healthcare, and last but not least, leadership and governments, which then result in the overall outcomes. Many of you have had already lectures on the health system, therefore I can afford to be quite brief on it, and those 6 building blocks come back to you in relation to NCDs in 1 or 2 of the key readings I'm recommending for this topic. Now, what are the shortfalls? The shortfalls you can look under its scale, the scope of the health system, the distribution of the services, the protection or safety issues of those encountering with the health service, and what we alluded already at the beginning, the shortfalls of inherent to the system's capability. A system geared towards acute episodes and acute diseases might not be ideal or capable to best deal with complex challenges. Here 2 slides going onto health system research, because essentially that is what we are talking about. How do we know that the current system is failing us? And I'll quote here from the WHO 2008 World Health Report that no other 5 trillion economic sector would be happy with so little investment in research related to its core agenda. And that's kind of interesting, because indeed there is very little research going on despite the size of the healthcare sector. To counteract that, some colleagues of mine here at the University of Copenhagen started a couple of years ago Health Systems Global, which is a platform to strengthen and coalesce individual communities of health system researchers, to facilitate a debate on key health system research issues, and to advocate for increased health system research funding and utilization. So please go and check them out on healthsystemglobal.org. You find their home site and the recent activities listed there. After talking about health systems, let's now talk about the primary healthcare approach. A paradigmatic shift, a huge idea. Coming from the late 60s, being formulated in 1978 during the Almaty conference, where people were talking increasingly about health instead of medicine, about holistic care, about local health care for many, as opposed to the specialized hospital care accessible only to a few, and about the socio-economic explanations and determinants rather than the biological causes of disease. Almaty hosted a conference. Now the place in Kazakhstan is called Almaty, 1978, which came up with a declaration of health for all by the year 2000. The Almaty Declaration put primary health care at its core as a strategy. And it has to be recognized, and most likely was very much on the minds of all attendees there, that the concept of primary health care has a strong socio-political implication. It explicitly outlines a strategy which would respond more equitably, appropriately and effectively to basic healthcare needs, and also addresses the underlying social, economical and political causes of poor health. In the World Health Report 2008, which is 30 years after Almaty and publicly available on the WHO website, you see the difference between the classic disease control programs, or sometimes called the vertical programs, to the people-centered primary health care. A very interesting juxtaposition of the different priorities and focus areas. 2008, 30-year celebration of Almaty, of its successes, but unfortunately also of its failures, were opened by Margaret Chan, the director and current director general of WHO, where she said she called for a revitalization of primary healthcare as an appropriate way, as an approach to strengthening health systems. And my argument in this presentation is also we need to revitalize primary healthcare as an approach of integrated NCD management. Back to our topic outline. Now let's talk about the integration of health services, what we mean by that, vertical versus horizontal programs, and a more newer paradigm, diagonal programs. To help explain what and why integrated health services will be discussed, I'd like to have this opening again by WHO, where they said, we need a comprehensive integrated approach to service delivery. Otherwise, we suffer from, or the health services suffer from fragmentation. And that is, I think, still a threat, a reality in many health services. What could be a definition of integrated service delivery? Well, that would be the management and delivery of health services so that the clients receive a continuum of preventive and curative service according to their needs over time and across different levels of the health system. So you can believe that why I put integrated health services at the core center of advanced NCD management. But looking at integration, and I include this WHO technical brief document that you don't have to read those details here on the slide, we have to recognize there are several dimensions, 6 dimensions of integration. So it is much easier to talk about integration than actually understand what is included. The package of services which could be integrated, we see some examples. Multi-purpose service delivery points which could be integrated, continuity of care from hospital to ambulance to home care, vertical integration, like integration between different vertical programs, integration of health services with policy making, and working across sectors. 6 different dimensions. So health service integration is actually quite a complex undertaking, and there are books written about it and separate courses given for it. This is not easy to read, but I just wanted to illustrate that basically integration occurs across several dimensions and they cross interact. So it's a 3D problem you have to look at when you want to assess what dimension at what level was integrated in what setting. Now, why do we talk about integration of health service and the role of primary health care? Is basically, I think, that is the way to improve the health system's response to the chronic disease challenge. Now, how could we strengthen the primary healthcare section? Now, how could we strengthen, improve the role of primary healthcare and deliver an integration of health services to improve chronic disease control? Well, one idea would be, should we provide chronic care across all diseases, basically merge the different healthcare services, broad healthcare approach, broad healthcare needs approach geared towards the prevalent burden of disease. Is that the way forward? Or should we offer multidisciplinary chronic care clinics for specific communicable diseases and NCDs, like for instance HIV and cardiovascular disease, diabetes and tuberculosis. So only in selected areas often, and I'll show you some examples. Or should we adapt existing communicable disease programs for NCDs? One idea is to use the direct observed treatment for tuberculosis system for NCDs, especially for diabetes. Saying, well, this system worked for the antiretroviral treatment delivery, and therefore it could also work for diabetes or hypertension. So those are 3 different possibilities on how we could strengthen primary healthcare and integrate across service delivery. If I'm already such a fan of integration, you might ask, well, what is the evidence for it? And I have to admit that, and concur with Briggs in 2006, not much has changed till then, that only a few studies of good quality, large and rigorous, have been carried out to investigate strategies to promote service integration in low and middle income countries, those countries who have the least resources to afford a non-integrated specialized approach for NCDs. So there is still a lot of work to be done, and I show you only a couple of those examples. Now let's come to the final part about solutions and those examples. And you might notice that I, in this presentation, have skipped the assessment of health systems, of the preparedness of health systems for chronic disease management. And the reason is I haven't skipped that, but this is a separate interview with Manuel Garcia Goni, who has recently published a very interesting paper in this area. So you'll find this interview somewhere else in our web platform. The solutions examples I'm showing one idea to increase the funding for primary health care, and then the integration of chronic infectious care with NCD management, as alluded to in the previous slides, and then I close with a couple of tools and examples. There is the 15 by 2015.org initiative, which was written up in the BMJ 2008. Remember, there was the 30-year anniversary after Health for All, after Almaty, they proposed to increase the funding for primary healthcare in developing countries by 15%, or taking 15% away from vertical healthcare programs by 2050. I thought a very interesting and laudable initiative, and if you go there, and I provide you here the link, you will realize there's nothing left of this initiative. Something happened and the website is not there anymore, but at least read the article. Here's one article linking service delivery, leveraging HIV programs to support NCD services. I'll like to point out and put in our reading list, and the other example I liked and put in the reading list is actually what the Management Sciences for Health is doing, a NGO who was giving out a fact sheet about chronic disease, a health system approach, and there you find actually that they offer solutions across several of those 6 dimensions of integration. Please look up those examples in our reading list. And with that, I'm coming to the end of this introduction to the topic health systems and NCDs, and like to acknowledge a number of my mentors, peers, and students in preparation of this topic. Thank you very much.